The topic today we are going to see is unexplained weight loss or unintentional weight loss. See, weight loss is a good thing. It's a healthy thing. But if you're losing weight without any explanation or without any effort or without unintentional, if you're losing weight, then it becomes significant. And you don't have to worry every time, but you have to look into why. And if the weight loss is more than 5% or if between 5 to 10%, within 6 months time you have lost weight without any reason, known reason, then it becomes very significant and you need to definitely see the doctor and get yourself investigated. And what are the common causes for unexplained or unintentional weight loss? First and foremost, we always say, even in natural aging, you will lose muscle mass. So when the muscle mass is gone, naturally you lose weight and you also look little shrunken or look sick sometimes. And other reasons for muscle loss are any trauma, fracture, prolonged hospitalization, bedridden, or these are the other reasons why the muscle mass is reduced, or without your knowledge, because of other diseases, your nutrition or especially the protein intake is very low, then you may lose weight because of the muscle mass is shrinking. And the next foremost we say is hyperthyroidism. When a thyroid is functioning low, you gain weight. When it's functioning more, then you'll be losing weight. Why? The basal metabolic rate or the energy expenditure, in spite of good food, good intake, you'll be losing your energy, you'll be losing the body weight. But of course you'll have other features of hyperthyroidism like palpitation, increased heart rate, body warm, all those things will be there. The third is, very important thing is diabetes. Diabetes nowadays can affect any age group. So diabetes could be a reason. You don't have to have the symptoms of diabetes all the time, like excess water intake, urination, infection, but most of the time we call the borderline diabetic. Most of the people will not have these kind of symptoms, but they will be losing weight. It could be, so unexplained weight loss could be a sign of diabetes. And rheumatoid arthritis is another one reason. It's an immunological disease which affects the joints. It's a chronic inflammation. So any chronic inflammatory diseases can cause weight loss, like your inflammatory bowel disease, like Crohn's disease, or even ulcerative colitis. They can cause, but of course you have other symptoms like bloody diarrhea or abdomen pain, all those things, nutrition deficiency. These are the immunological reasons like rheumatoid arthritis and inflammatory bowel diseases. And apart from that, cardiac diseases. Suppose somebody has a cardiac problem, congestive cardiac failure, the effective pumping of the heart is very less, then they will have they can lose weight, but they will have other symptoms like leg swelling, all those things, but they may be losing weight. And another cardiac reason is endocarditis, infection of the internal layers of the heart. These are another reason they lose unexplained weight loss. And of course TB, another main reason is TB. Tuberculosis, probably they may lose weight because the energy requirement of the body increases. Moreover, the disease, the bacteria, takes all the nutrients and energy, so they can lose weight. And very, very importantly, depression and psychological reasons. Most of the people who are depressed, they eat a lot and gain weight, but people who come under a certain group of depressed people, especially if it's combined with anxiety, they lose interest in anything, especially food, and they can have a weight loss. Even ulcer, in another chronic diseases, they can cause weight loss. So weight loss, if it is, even if you come to a normal weight range, in spite of that, if it is unexplained, then you have to see the doctor and get yourself examined and rule out anything, any pathological thing. Or if you're losing weight only for a temporary period of time. See, people who are admitted for some time in hospital, you come back for 1 or 2 months, your weight loss That is accepted one, provided you gain back your weight after 2 months, that is fine. But if it's prolonged weight loss and you are losing more weight, then again you have to go to the doctor and get yourself examined. And the weight loss, if it is more than 10% of the body weight, and if it is within a short period of 6 months, and if there is no reason, definitely you have to go to the doctor, get yourself examined, get yourself investigated, and get a proper solution. Thank you.